Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about locum tenens. This shouldn't be a long video, but I think that there could be some confusion behind locum tenens, and so I thought it would be helpful probably to just do a brief video about what CMS's guidelines are when it comes to locum tenens. I'm going to talk about CMS or Medicare's guidelines because a lot of commercial payers will follow CMS guidelines on many things, including locum tenens billing. But if you're ever unsure about how to bill locum tenens for any other insurance other than Medicare, I strongly encourage you to read your contract with that payer. If it doesn't specify, then I would look on their website, I would call customer service or provider relations, and make sure that you're not going to be doing anything that could get you into any kind of billing trouble. So today we're just going to talk about CMS guidelines, and you'll want to follow up and look at and make sure you do your research before you utilize locum tenens in the future for your practice if you're going to be using it for your specific payers. Now, what is locum tenens? Locum tenens allows a substitute physician to fill in for a regular physician during an absence, where the regular physician would be completely unavailable and that regular physician is okay to bill to the insurance company and is in good standing. Certain requirements have to be met in order to use locum tenens, and there is a time frame restriction, so we're going to talk about that. Some of the requirements here seem pretty obvious if someone's going to be hiring a physician to provide locum tenens services, but then some things could be a little gray area or confusing, so I am trying to make it as straightforward and easy as possible to understand. Remember, this is per Medicare guidelines. So the first requirement is that the regular doctor who this other doctor or practitioner would be filling in for is completely unavailable. Now, this could be due to pregnancy, vacations, illness, active duty deployment for the military, continuing education, something like that. Another requirement is that it's patients who would be normally seeking their regular doctor or physician or practitioner for these services, in which the substitute practitioner would be offering their services in place because the regular physician or practitioner is unavailable. So 2 things so far. The doctor or practitioner has to be unavailable, and the second thing is that they have to be seeing patients who would be normally seeking out their regular physician for these services. The third thing is that the practitioner has to be compensated or paid by the day, so per diem, or for the service time in which they are going to be participating and filling in for the other regular physician. The one thing that a lot of people don't understand is that it's only good for a maximum of 60 days per year. Now, your per year is from, I believe, January 1st to December 31st, but again, I would definitely make sure you figure out what that year timeline is for those 60 days. And it can either be consecutive 60 days, or they can be broken up and kind of accounted for of using them here and there or weeks at a time, whatever. But they can't exceed 60 days. The other thing is that any services that are billed that you would normally be billing just as usual for this regular provider under their tax ID and MPI is totally fine, because this locum tenens is in place of that. But you have to indicate it's locum tenens by using modifier Q6. So you would bill normally for the same provider as always for the same services, but you have to include the modifier Q6. That is indicating a locum tenens physician or practitioner is covering for the regular doctor. And you have to make sure that the practitioner that is covering has not been reassigned through Medicare for the practice, meaning they can't be an employee already of the practice. They have to be completely basically disassociated with the practice. There's someone coming from the outside that's going to just fill in temporarily for the regular practitioner. If it is someone who is already contracted and credentialed with the company, then you would bill under their MPI and tax ID. This is for someone who is completely not affiliated. Some things that you need to know is that if they're 60 days continuous, once you hit that 60-day mark, and it does include weekends, so the first day that they see patients through the last day, even if they didn't see patients that whole time, but that continuous period is going to be the 60 days. So on the 61st day, you would not be able to bill under the regular provider, and you would have to bill out under the provider in which who is providing the services. So if the 61st day comes along and they have consecutively used that seeing patients, then that 61st day, they're going to have to use their own MPI and tax ID number to bill out services in which they offer to patients. Now, there's some confusion still, I'm sure, because you can use the 60 days off and on throughout, but then if you do it consecutively, it counts, in my understanding, the weekends. So, I mean, I definitely encourage you to look into CMS further if you're going to be utilizing locum tenens. Like I said earlier, check with your other payers, contracts, and provider relations people, because I'm no expert, but these are definitely the things that I understand that are the most important. That the regular doctor cannot be available or on the premises at all. It has to be patients seeking normal services from their regular doctor. You have to use a modifier. You can't be affiliated with the group or the practice whatsoever, and it's only good for 60 days. Those are the big things. All of the other little questions that might come up or situations and circumstances, I encourage you to do your due diligence, look it up, and make sure you're not doing anything you're not supposed to. If you have any questions, comments, concerns, leave that in the comment section for me. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. Take care of yourself and enjoy the day. Bye-bye.